Hi there, I'm Dr. B.
Hello.
Can you just confirm your first name for me?
Jerry.
Jerry, okay, great. So Jerry, I have you down for a cranial nerve assessment and some in-depth sensory exams, is that correct?
Yes.
Okay. And is this just a regular checkup or something been bothering you?
Just making sure everything is right as rain.
As you should, that's great. So what we're going to do is we'll first focus on those cranial nerves. Most of them are in your head and neck, and then we'll move down and do some in-depth sensation, not only on your face, but on your arms as well, okay? If you have any discomfort during the test, just stop me. And are you currently in any pain or discomfort before we begin?
No.
Okay, so on a scale from 1 to 10, 1 being no pain, 10 being excruciating, you'd be around a 1. Okay, excellent. And I'm just going to quickly just make sure nothing here is painful, right?
Right.
Before we start sensory testing. All right. So I'm going to quickly sanitize my hands here. And I'll just start out with the eyes. So I'm just going to take a look at them first. Just look straight ahead for me. Okay, and I want you to keep looking that way. I'm going to shine a light in your eye. Good. Just making sure everything's constricting. Okay, again, stare straight there and ignore my pen. And now look at the pen. Any double vision here? Okay, follow it out. And follow it in. When does it start to be double?
Now.
Perfect. So I'm going to keep my pen around here, and I want you to follow it with just your eyes. Don't move your head. Any dizziness or double vision there? No? Okay. Just look at your pupils. Out of 4. Same thing on this side. I'm going to look a little closer into the eye now. I'm just going to get a little bit close here, so I do apologize. I'll just, again, stare straight ahead. Very good. Same thing on this side. That looks great. Do you wear any glasses or contacts?
No.
Okay. If I hold this about here, can you read that lowest line for me?
LTFPH.
Perfect. Go ahead and block one of your eyes with this. I want you to read the same line just backwards.
HPFTL.
Okay, and switch eyes. And read it forwards again.
LTFPH.
Okay, and what color is this?
Red.
And this?
Green.
And switch eyes. And does it still look red and green?
It does.
Okay, perfect. Hold on to this actually. I'm going to do some peripheral testing. So again, pick an eye in front. Okay, perfect. And I want you to just stare straight at my nose. And keep looking at my nose and tell me when you see my fingers wiggling in the corner of your eye.
There.
Okay, and keep staring straight at me. Try one more time.
There.
Good.
There.
Good.
There. There.
Okay, and can you switch eyes for me, please?
There.
Hmm?
There. There.
Okay, and I'll take this back. Again, keep staring at my nose. How many fingers am I holding up?
4. 2.
Okay, and which side is wiggling, left, right, or both?
Left. Both. Right. Both.
Very good. So vision seems to be really intact. And like you said, you have no glasses, no contacts, no general vision problems. Okay. All right, so I'm just going to take a look into your nose now. Do you have any issues smelling or breathing? Can you breathe in for me like that? Plug that up. A little bit. Is normal for you to just have a little bit of blockage?
Just a little allergies every once in a
Yeah,
while.
okay, perfect. I'm gonna give you some things to smell. And I'm just looking for the general scent here. So it doesn't have to be perfect, but about what it smells like. So first one here.
Lemon.
Mm-hmm, that's exactly right. And that there.
Mint.
Mm-hmm. And we'll do one more just for fun. This one does not want to get smelled.
Lavender.
Perfect. So that's all fine. Any differences in your taste of late?
No, I don't think so.
So just open and say all for me. Just want to see that palette. Perfect. And how often are you going to the dentist?
About twice a year.
Perfect. I'm going to put on some gloves. So I'm going to do a couple of tests here around the mouth. While I'm doing this, can you lift your eyebrows for me? Okay, very good. Just checking for symmetry. Can you close them really tight? Don't let me open them. Okay. And can you puff your cheeks out? Okay, hold them there. And then can you take your tongue and push it into the side of your mouth here? Same thing on this side. Can you stick your tongue out and move it side to side? Okay, good strength there. And feel your jaw. Just want you to open and close for me. Okay, and clench for me. Good strength there. Good strength in the jaw. Can you let your jaw hang for me? I'm gonna test a reflex here. Good, no reaction there. And just checking the head as long as I'm up here. No pain in the head, anything like that. Take a look at the ears. How has your hearing been lately?
Pretty good.
Okay, now we're having a conversation, you're able to respond, so that's really good. Any pain here?
No.
About back there. Okay. Checking this side as well. No pain.
No.
I'm gonna include one of your ears here, and I'm gonna whisper into the other one, and I want you to just repeat after me what you hear, okay? 479.
479.
Good, and on this side? 1123.
1123.
Okay, close your eyes. I'm gonna make a little soft sound next to your ear, and I want you to tell me left, right, or both.
Left. Right. Both.
Okay, tell me when you can't hear this anymore.
There.
Okay,
There.
very good. So that all looks fine. Do a couple more hearing tests just to make sure everything's fully working. I'm gonna hit this, I'm gonna put it right in the middle of your head. It's gonna make a noise. I want you to tell me which side you hear it more on or if it's equal. Okay, and again, close your eyes.
Equal.
Okay, I'm gonna place it behind this ear here. Can you hear that there?
No.
What about here?
No.
How about now?
Yes.
Okay, tell me when it goes away.
There.
Do you still hear it up here?
Yes.
Okay, perfect. I'm gonna do the same thing on the other side. What we're looking for is that bone conduction is not quite as good as air conduction. You hear that there now?
Mm-hmm.
Tell me when it goes away.
There.
Do you still hear it here?
Yes.
All right, I'm going to test a little bit of your strength in your neck here. That's cranial nerve 11. So I want you to shrug your shoulders for me against my resistance. Keep going. Very good. And turn your hand towards me. There you go. And push away. And can you go down? And back. Very good. And then do that without me. I want to see how your range of motion is. Look all the way that way. And come all the way back here. Down as far as you can go. And back as far as you can go. Any pain in the neck shooting up into the head with that?
I don't think so.
Wonderful. I'm going to start out with a little bit of a facial sensation now. And the first thing is going to be this really light puff of air. Do you feel that there?
I do.
Okay, so I'm going to do it. I'm just going to push this on the side here. I'm going to do it on each section of the face, and I want you to say yes when you feel it. So close your eyes.
Yes. 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 Yes.
Okay, and does it feel the same here and here?
It does.
Here and here?
Yes.
Here and here.
It does.
Perfect. I'm going to do the same thing but with cold. So you feel how that's cold and that's a little warmer. I want you to tell me cold or warm.
Okay. Cold. Warm. Warm. Cold. 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 Warm. Cold.
Okay. While I have this, I'm going to hit it. It's going to make a buzzing. I want you to tell me if you feel the vibration and when it stops. Keep those eyes closed. You feel it vibrating?
I do.
Tell me when it stops.
There.
Good. Same thing, I'm going to do it on your cheeks. Feel the vibration?
I do.
Tell me when it stops.
There.
Same thing here.
There. There.
Okay. So really good sensation there with those fine movements. I've got a bit of a dull and a bit of a sharper point. You feel the difference between those two?
Yes.
Okay. I'm going to test this one all over the face, and I just want you to tell me sharp or dull.
Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Sharp.
Okay. And did any of these feel less sharp here or here?
No.
Okay. The last thing I have for you is a much sharper tool, and I'm just testing to see how fine you can feel with the facial muscles. So I'm going to go very lightly here. Does that feel sharp all the way?
Yes.
Okay. Does this feel sharp all the way?
Yes.
Feel sharp all the way down?
Yes.
And even here?
Yes.
Okay. So facial sensation looks good. Everything is working as expected and normal. So everything in the face looks good. You're able to feel everything. There's no loss of sensation. You're able to make facial movements. I just want to get a couple of measurements to make a note, since this is the first time I'm seeing you, so we can monitor it for any swelling in the head or the neck, okay? Okay. I'm just going to get one around the neck, and I'll be very gentle here, okay? Perfect. All right, I want to do some reflexes with you. So first things first, just stare that way and ignore me. And I'm going to scrape your hands a little. Okay. That's good. I'm going to tap right here. Okay, can you put your arms out nice and straight for me? And flip them over. And can you close your eyes? I'm going to tap them, but don't move them. Can you touch your nose with this finger? Okay, and how about with this finger? All right, open up. You can open your eyes and relax your hands. I'm going to have you touch your nose and touch my finger. And just follow it everywhere it goes. Back to your nose, back to my finger. Excellent. Can you switch hands for me? Very good. I'm going to have you do a couple of movements. I want to test your rapid alternating. So you Touch every finger back and forth like that. Okay. And what about flipping your hands like this? As fast as you can go. And then like that. And can you flip hands? Very good. So you're pretty ambidextrous when it comes to that kind of thing. Sometimes people will stumble on their non-dominant hand. Can you take your heel and run it down your shin for me? Okay, and on the other side. Very good. And no pain with any of that, right? Okay, we'll do some strength testing. So put your arms up like this. And can you push against me? And pull. Okay, very strong. Put your arms up like this and push against me again with your fingers, your hands only. Yeah, just like that. Yeah, push up and then pull back. Like that, pull back. There we go. Fingers up like this. Keep your thumbs up. Good. Fingers out nice and wide. Don't let me close them. Okay, I'm going to give you a little piece of paper here. I want you to open your hands like this. I'm going to slip this in there. Don't let me take it from you. Good. Same thing on the other side. Keep it away. Very good. 5 out of 5 strength everywhere in the arms. Up like this for the last one. Let me push you down. Okay. And then I'm just going to hold your wrist, and can you just show me side to side? Okay. And just do that against my resistance. Good. Same thing here. This way. This way. And again, no pain in the joints or anything. Just feeling those really quickly. All right. We'll move on to the sensation testing in your arms, and we'll also be doing some more stuff with your hands. Do you mind if I roll this up a little? Okay. We're going to do everything we did on the face onto the arms. But the difference is I want you to start by closing your eyes and just point to where I touch you. Okay. Good. Okay, so you're able to tell that. Say left, right, or both.
Both.
Good.
Right. Left.
Okay, so you're able to differentiate which side I'm touching, and that'll be good to determine equal feeling. So I'll just start with a real light touch, and I just want you to say yes when you feel it.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, as long as I have this, I'm going to do sharp, dull. So again, does that feel different from that?
Yeah.
Okay, so this is sharp and this is dull.
Okay. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp.
Very good. Does that feel cold?
Yes.
Does that feel warm?
Mm-hmm.
Okay, tell me cold or warm?
Cold. Warm. Cold. Cold. Warm. Cold.
Does that feel cold all the way down the arm there?
It does.
Same here, all the way down?
Yes.
Okay, I'm going to hit it. It's going to make a buzzing sound. You're going to feel a vibration. First tell me yes, you feel the vibration, and then when it stops. You feel the vibration?
I do, yes.
Tell me when it goes away.
There.
Perfect. Same thing here.
Yes. And there it is.
Okay.
Yes. And there it is. Yes. And it's gone.
Great. And the last thing is just that real light puff of air. And I just want you to tell me if it feels the same both sides, because we established that you can feel pretty sensitive. So does that feel as strong as that? That and that?
Yes. Yes.
Does that send any nerve discomfort or tingling on the skin?
No.
Okay, great. All right, I'm going to grab your reflexes here, so you can go ahead and put this down. I'm going to have you give me all your weight. Just relax your arm completely in my arms here. Just like that. Give me all your weight. we go. Okay. Just relax for me. The reflexes aren't too brisk, but they're reactive. Okay. I'm going to draw something in your hand here. It's going to be a number, and I want you to tell me what you feel, okay?
3.
Yep. What's that?
1.
Okay, can you add those two together?
4.
Okay, I'm going to take the other hand. Now I'm going to spell a word. I want you to tell me what the word is. So, first letter.
O.
Let me get something a little more fine here. Okay, so try again.
B.
Mm-hmm.
O.
Mm-hmm.
Y.
Correct. And what does B-O-Y spell?
Boy.
And what is a boy?
A man. A young man.
Okay, perfect. And that just tests your cognitive reasoning, and sometimes this can be hard to feel in the hand. So again, I'm not worried. You're able to sense everything else. Close your eyes for me. I'm gonna place an item in your hand. Tell me what this is.
A pen.
Okay, very good. And I'm just gonna do one more thing. Can you tell me what, just in this hand, what this feels like?
A debit card or business card.
Feel around a little bit. There's some different shapes.
A comb.
Yes, correct. So that's also really good. I'm going to do 2 more tests on the hands. I'm going to be moving your finger up or down. Do you feel the difference between those two? Okay, close your eyes and just say up or down.
Down. Down. Up.
Okay, I'm going to try it over here.
Up. Down. Down.
Okay, same thing on the other side. Very good.
Up. Down. Up.
Okay.
Down. Down. Down.
All right. And then I'm going to poke you with either 1 point or 2 points. And I just want you to tell me if you feel 1 or 2. So go ahead and flip one hand over, whichever you prefer first. So that's 2 points and that's 1 point. Okay?
Okay.
So just say 1 or 2.
2. 1. 1. 2.
Okay, and same thing on the other side.
1. 2. 1. 2. 2. 1.
Excellent. Alright, so we've established that everything is functioning as it should. I want to get just a couple of knee reflexes. If you can scoot back on the bed here. And we'll do some quick strength testing. Can you push up against my hand? Good, and push out. Okay. Get these here. Okay. And that all looks fine. So let me just check my notes. See if there's anything else I want to look at, but otherwise that completes our cranial nerve and sensation exam. Do you have any questions for me before I let you go?
I don't think so. Everything looks good.
Okay, well, thank you, Jerry. And just if anything changes, come back. But otherwise, we'll see you in about a year for your routine visit.
Thank you.
Thank you.